In today's video, we're going to discuss a supplement you may have heard about, glutamine. Yes, glutamine is everywhere. I've seen it on social media, on ads, and I've seen it at virtually every single natural food store. I'm gonna discuss exactly what is glutamine. We'll discuss why you should maybe consider taking glutamine. We'll discuss what glutamine does to your gut health. We'll discuss, are there people who should not in any circumstances take glutamine? And at the very end of the video, I'll give you my recommendation on which patients may benefit from glutamine. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe so you get more videos like you're watching in today's video. What is glutamine? Glutamine is the most abundant amino acid in your body. Amino acids are the building blocks for protein to get you swole and strong. And normally your body can make enough glutamine to sustain its regular needs. But there are times of stress when you actually may need more glutamine than what your body can make. And this could occur from either heavy exercise, injury, or sometimes even medical conditions. Now, glutamine is important to remove ammonia, which is a waste product that your body makes. And it also helps to maintain immune function, brain function, and your digestion. Now, like I mentioned before, in most cases, your body produces enough glutamine to go through normal everyday function, not a big deal. However, there are some conditions, whether it's an infection, prolonged stress, digestive issues, injuries, or surgery in which your glutamine levels may fall below what your body needs. You may need some extra boost or supplement to help out with that. So what does glutamine actually do for your gut health? Now, there's some research to suggest that glutamine can actually help out with the lining of your GI tract. So if you suffer from either leaky gut, some absorption issue, or maybe some chronic GI conditions like IBS, reflux, or gastritis, that lining of your GI tract can be impaired and cause things to seep through, causing infections, irritation, and inflammation. And sometimes taking glutamine can help seal up those repairs, seal up those holes to allow that healing to occur. Now, the data is very mixed, the research all over the place, and we don't have any clear evidence that glutamine is beneficial for everyone. So I want to stress this. And we also think that glutamine can play a role in your microbiome. All the foods that we eat here in the US, unfortunately, are ultra processed, terrible for your gut, and they produce inflammation inside your GI tract. It's crazy the amount of inflammation that we put inside our bodies. This changes the balance, the natural ecosystem of what's going on inside our GI tract. All the time, we have this battle between the good bacteria, the good fungi, the good viruses, and the bad guys who can proliferate and destroy the good guys whenever you have too much processed food and food that's just not good for you. It feeds the bad guys, and that in turn can manifest in all sorts of different symptoms: nausea, vomiting, bloating, cognitive issues, depression, anxiety, everything both inside the gut and outside the gut. And research on that amino acid glutamine has been shown that it can help rebalance the gut microbiome to give the good guys the reinforcements that they need to help fight off all that inflammation. And not only that, it can help out with the lining of your GI tract, to plug up any holes that might be there to allow you to heal your gut. Now, I want to stress this, not everyone should take glutamine. In fact, there are patients in which I would never recommend this to. Number one, anybody with a food sensitivity to the additive MSG, or monosodium glutamate. Number two, people with liver disease should not take glutamine. Number three, people with bipolar disorder should not take glutamine. Number four, people with a history of seizure disorder should not take glutamine. So what do I, as a GI doctor, recommend when it comes to glutamine? Well, it really depends on what we're treating and what our goals are. So like I mentioned before, like any supplement, we don't have a lot of good data when it comes to the benefits and the risks. We just don't have the information out there. What we do know is that there are certain individuals, like I mentioned before, that should not take glutamine. However, there are certain conditions in which we've seen a benefit, whether it's irritable bowel syndrome or IBS, inflammatory bowel disease like Crohn's or colitis, reflux or heartburn, and even gastritis. We've seen the evidence for that. Everyone has different needs and everyone has different body mechanisms. It also depends on the goal of treatment as well, because are we using this as part of a plan, an overall plan to get you feeling better and get you healthy, or are we just trying to supplement ourselves without getting down to the root cause, what typically is your diet, stress, and sleep? It really depends on a lot of different factors. In the right patient, I will recommend glutamine to help out as part of the collection of treatments for my patients who have gut disease, but not everyone. So what I would recommend is make sure you speak to your healthcare provider, discuss your needs, your conditions, your medical history to see if you may be the best person to take glutamine. So my call to action to you today, I want you to take action to contact your doctor. Ask them, should you take glutamine to help out with some of your gut issues or even other issues? See if this regimen is right for you. My question today for you, have you tried glutamine? Has it worked? Has it not worked? What has it worked with specifically for you? Comment down below. I would love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe so you get more videos like you're watching in today's video. And don't forget to check out my video, 5 best ways to treat your IBS. Guys, so thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.